care for the family and need of reproductive life planning.
Barrier methods are forms of birth control that place a chemical or latex barrier between the cervix and advancing sperm cannot reach and fertilize an ovum. Spermicide is an agent that causes the death of spermatozoa before they can enter the cervix. The advantages of spermicides include they may be purchased without a prescription or an appointment with a healthcare provider, so they allow for greater independence and lower cost. Vaginal insertion of a spermicide is to insert and have an ideal failure rate of 9% and a typical use failure rate of about 16% to 20%. Cope and Cages 2010. Caution: woman preparation labeled feminine hygiene. Products are for vaginal cleanliness and are not spermicidals. Side effect and contraindications. Vaginally inserted spermicidal products are contraindicated in women with acute cervicitis because they might further irritate the cervix.
This is the proper way how to put on and take off a male external condom. Carefully open and remove condom from the wrapper. Place condom on the head of the erect hard penis. If uncircumcised, pull back the foreskin first. Pinch air out of the condom. Unroll condom all the way down the penis. After sex, but before pulling out, hold the condom at the base. Then pull out while holding the condom piece. Carefully remove the condom and throw it in the trash.
Male and female condoms. A male condom is latex rubber or synthetic sheet that is placed over the erect penis before coitus to trap sperm. Male condom have an ideal failure rate of 2% and a true failure rate about 15% because breakage or spillage occurs in up to 15% of uses. A big advantage of male condoms is they are one of few male responsibility birth control measures available. How to use condoms properly. First, check the expired date. Second, open the package. Never use any sharp objects. Third, hold the tip of the condom to remove the air. Fourth, roll the condom down to the base of the penis. Fifth, use each condoms for only one intercourse. Do's and don'ts of using a condom. Do use a condom every time you have sex. Do read the package and check the expiration date. Do make sure there are no tears and defects. Don't reuse a condom. Don't use more than one condom. Don't use oil-based products like baby oil because this will cause the condom to break.
Nursing role in preparing families for childbearing and child rearing. Condoms for females are sheets made of latex or polyurethane, pre-lubricated with a spermicide, so the same as male condoms. They offer protection against conception as well as sexual transmitted infection and HIV. The inner ring, closed-end, cover the cervix, and the outer ring, open and rest against the vaginal opening. The The seat may be inserted anytime before sexual activity begins and the remove after ejaculation occurs. They can be purchased without a prescription but are most expensive than male condoms. Male and female condoms should not be used together or there is an increased chance of tearing one or the other. How to use a condom female. 1. Check the condom package. Number 2. Insert the condom before vaginal or anal sex. 3. Open the condom wrapper using the easy tear aids. 4. Get into a comfortable position. Number 5. Squeeze the inner ring at the close end of the condom. Number 6. Insert the inner ring into the vagina. Number 7. Pull out your fingers. Number 8. Apply water-based lubricant to the penis or sex toy. Number 9. Guide the penis or sex toy inside you. Number 10. Stop immediately if something goes wrong. Number 11. Remove the condom slowly. And the last one, dispose of the condom discreetly.
Before expected coitus, after first coating the inside rim and the center portion of the diaphragm with a spermicide gel, the diaphragm is inserted into the vagina, sliding it along the posterior wall and pressing it up against the cervix, so it is gripped by the vaginal fornices. A woman should check a diaphragm with a finger after insertion to be certain it is fitted well up over the cervix. She should be able to palpate the cervical OS through the center of the diaphragm. Side effects and contraindications. The diaphragms may not be effective if a uterus is prolapsed, retroflexed, or antiflexed. To such a degree, the cervix is also displaced in relation to the vagina. Intrusion on the vagina via cystocele or rectocele, where the walls of the vagina are displaced by bladder or bowel, may also make insertion of a diaphragm difficult. Users of diaphragm may experience a higher number of urinary tract infections or the UTIs than non-new users, probably because of pressure on the urethra. Other contraindications include the history of toxic shock syndrome, TSS, a staphylococcal infection introduced through the vagina, allergy to rubber or spermicides, history of recurrent UTIs. To prevent TSS while using a diaphragm or cervical caps, advise women: Number 1. Wash their hands thoroughly with soap and water before insertion or removal. Number 2. Do not use a diaphragm during a menstrual period. Number 3. Do not leave a diaphragm in a place longer than 24 hours. Number 4. Be aware of the symptoms of TSS such as elevated temperature, diarrhea, vomiting, muscle aches, and sunburn-like rashes. Number 5. If symptoms of TSS should occur, immediately remove the diaphragm and telephone a healthcare provider. A cervical cap is made of soft rubber shaped like a thimble which fits snugly over the uterine cervix. The failure rate is estimated to be as high as 23%, ideal to 35% typical use, because caps tend to dislodge more readily than diaphragms during coitus.
Care methods and effect on pregnancy. If conception should occur while using a barrier methods, there is no reason to think the fetus will be affected. Some women worry a sperm that survived as spermicide must have been weakened by migrating through and therefore will produce a child with problems. They can be assured conception most likely occurred because the product not completely covered the cervical os, so the sperm that reached the uterus was fresh of the products and unharmed. Methods and effect on social enjoyment. Also, barrier methods must be inserted very close the time of coitus. Most coitus, some couples do not find the convenience of insertion, only minor problem. If couple is concerned the time method does not offer enough protection, worrying about becoming pregnant may interfere with sexual enjoyment. The use of a vibrator as a part of foreplay, frequent penile insertion, or the woman's superior position during the coitus may dislodge a diaphragm or cup. Barrier methods and adolescents. Many adolescents use spermicides as their chief method of birth control because of no parental permission or extensive expense involved. Adolescents may fitted for either diaphragms or cups because an adolescent girl's vagina will change in size as she matured and begins sexual relation. This device may not remain as effective as they do with older women and so need refilling more often. Male adolescents are showing increased ability to use condoms responsibly. They may need to be cautioned that condoms should never use because even a pinpoint hole can allow thousands of sperm to escape. Adolescent boys who have infrequent coitus may have condoms they have owned and stored it for the long and the perimenopausal woman. Older than 35 years old have a higher incidence of cytocell or rectocell than younger women, so diaphragm or cervical cups may not be the ideal contraceptive for them. Spermicide foam can help lubricate the vagina to increase sexual enjoyment in women nearing menopause. Use of vaginal film or suppository is not recommended as least vaginal secretions may prevent the film or suppository from dissolving completely. Methods and a postpartal woman. Vaginal spermicides are appealing to postpartal women. They can be purchased over the counter and have no effect on breastfeeding and so can be used in the short time period before a postpartal checkup with a more permanent form of contraception can be discussed and prescribed. As the cervix changes considerably with childbirth, women must be refitted for diaphragms and cervical cups after childbirth. This is usually done at 4 or 6 week checkup.